In Australia, flu is our most common vaccine preventable disease. It is more than a trivial illness. In Australia last year, there was over 500,000 cases, and that resulted in over 20,000 hospitalisations and sadly thousands of deaths. So FluMist is an intranasal vaccine. It's a fine spray that is squirted up each nostril. The WA government is investing $7 million to deliver 130,000 intranasal vaccines to children 2 to less than 12. Those vaccines will be available through general practice, through community clinics, through the Aboriginal controlled health sector, and through pharmacies. It doesn't hurt. In fact, it's very well tolerated in children, and that's why we've moved to the intranasal vaccines. Many parents have told us they don't like needles associated with flu vaccines, and so this is a great opportunity for a needle-free, painless approach to flu protection.
There can be some side effects. The most common side effects are nasal symptoms such as a runny nose. This is because of the way the vaccine works in terms of causing a local reaction in the nose.
If your child sneezes immediately afterward, I would not be worried. There is sufficient dose within the vaccine to still have an impact.
FluMist works just as well as the traditional injectable vaccine. There's been more than 100 studies that have shown this to be the case. There's a lot of experience from its use in the Northern Hemisphere, and in fact, there's evidence from school-based programs that it is just as effective. For FluMist, the nasal vaccine is very safe. In fact, it's been used in Northern Hemisphere for more than 20 years.
The FluMist vaccine is best to have before the flu season. So in Australia, for most Australians, that's the winter time. In Western Australia, we normally start seeing flu activity in late May, June and July. So April and May is the best time to get a flu vaccine.
So there are certain groups that become very susceptible to severe infections from flu. This can be our very young and our older population. So it's really important that we can have these groups protected. We want to protect school-aged children against the flu. If we vaccinate this group, it not only protects them from severe effects of flu, but it also protects other groups in the population. The impacts are not just on the individual who gets sick, it's their family as well. Parents need to take time off work to look after their children or even look after their older adults. So if we can have higher vaccination rates for flu, the broader effects and the broader benefits of vaccinating against flu is going to be seen across society. You'll have less parents taking time off work, less children missing school, less children missing childcare, and a happy, healthy community. If we can increase flu vaccination rates in school-aged children, even by 10 to 20%, that can actually reduce flu cases for all ages by up to 30%.